So now I'm very pleased to introduce Aki Smith, who is a caregiver and patient advocate. She started her journey advocating on behalf of her dad, but now that those efforts have reached many, many more people. And she's the founder and executive director of Hope for Stomach Cancer. Big round of applause for Aki Smith.
I'm so nervous. I think I'm the only person here without a PhD or an MD. Okay, thank you so much for being here. Thank you so much for the invitation. My name is Aki Smith, and I'm the founder of Hope for Stomach Cancer. We are headquartered in Los Angeles, where there are about 2,000 newly diagnosed patients annually. Let's see, how do I click this? Okay, there you go. So I'm here to tackle the question, what can patient advocacy groups to impact health policy? While the answer isn't so straightforward, or else we'd be doing it, I'm going to try to attempt to answer it. I'll be using my own story as an example, talk about the creation of Hope for Stomach Cancer, briefly talk about what the problem is, what some advocacy groups are already doing, and how we can help impact healthcare policy. My dad was diagnosed with stomach cancer in December 2013. After going to the emergency room with gastric bleeding the month prior. He spent 2 days in the hospital doing different diagnostic testing, such as an endoscopy and a colonoscopy. He was actually discharged with a diverticulitis while awaiting biopsy results. As an only child, I practically called the GI doctor every day for the results. 10 days after my dad's discharge, I finally got a hold of the GI doctor and got the answer I needed to hear. The biopsy report, as suspected, came back negative. Thankful and relieved, I scheduled a hospital follow-up and a physical for my dad with a PCP. I didn't go to that doctor's office visit because I honestly thought my dad was going to get his first prostate exam, and I didn't think it'd be appropriate for me to be there. Unfortunately, my dad learned of his stomach cancer at the PCP by himself. The negative biopsies the GI doctor read to me over the phone were actually the polyps from his colonoscopy. My dad's stomach looked so clean that the GI doctor didn't look at the biopsy report from the endoscopy. My dad was all alone when he learned that he had stomach cancer. So for the GI doctors in the room, this was his endoscopy in 2013. My dad's diagnosis was stage 3B, T4, N2, M0. His tumor was 7.5 centimeters. He had a total gastrectomy, 6 cycles of FOLFOX, 25 times local radiation, and 1 year of Herceptin. When my dad was diagnosed with stomach cancer, there were no standard guidelines or resources. I began being my father's patient advocate, dealing with insurance, scheduling appointments, researching and crying. I did a lot of crying. I promised myself that if my dad made it through, I would pay it forward. I couldn't believe that even after having a total gastrectomy, his chances of reoccurrences were so high. I often told my husband we have better odds going to Vegas. When I started Hope for Stomach Cancer, I knew that I wanted to give back. I knew that I had to add prevention and early detection to our IRS paperwork. I often think back to the time when my dad was first diagnosed and think, wow, we were so naive. My dad had so many risk factors. He was literally the poster child of stomach cancer. 71 years old, male, Asian, Japanese to be specific. His brothers had stomach cancer. One of them even died in his early 30s. My dad also eats a lot of nitrates and processed foods, and a lot of ethnic foods are high in salt. He was slightly bigger at 5'7" and 171 pounds, and he lost 20 pounds so quickly. A smoker for 50 years, and unknown to him, his best friend of childhood was diagnosed with H. pylori. In fact, his best friend told my dad to get a test, and my dad said no. And then there's me in my 20s. What are my risk factors? I'm half Japanese, first generation. My father and my uncles were diagnosed with stomach cancer. I was born in California, not a smoker, not a drinker, healthy eater, relatively stable weight. This would probably be my heaviest weight right now. Outside of a few things, I would say my risk factors are very minimal. What should I do? I continued to be my dad's caregiver. Eventually, my friend and founding board member, Randy Hillard, said, Aki, you really need to get an H. pylori test. And I'm like, what for? But his nagging got to me, and I asked my PCP for a breath test. My PCP looked at me and said, no, insurance will improve this. You need to give me symptoms. I gave her that look. You mean my dad almost died from stomach cancer due to H. pylori, and that's not enough for me to get an H. pylori test? So I have these hunger-like pain at night. It's really annoying. Sometimes I even have to eat in the middle of the night to make this pain go away. Based on that, she ordered the test, and surprise, surprise, I did test out positive. I had to go on a tough course on the antibiotics for 10 days. It was turned out to be, it was pretty miserable, but not as miserable as what my dad had endured. I retested 6 weeks later and tested negative. In 2016, that was enough. However, in 2019, I realized through research that I do need to follow up with an endoscopy, and that hunger back at night came back. I also have a child, and we eat dinner at 5:30, so that could be that, but I've been going to see different GI doctors in my area, and I'm scared. The first guy I met with said that he didn't see stomach cancer in my age group, and the second doctor I met with, she no longer takes my insurance. So I lack confidence. But to me, the real problem, this is the real problem. My dad is no longer the poster child of stomach cancer. The real problem that we're facing in advocacy groups is that we're seeing stomach cancer in younger and younger people. And most of the time, by the time it's found, it's advanced. I'm going to tell you a story about my friend Brandy. And I'm going to be a little bit sad, so she passed away. She spent 5 years in the Navy, stationed in Japan. Upon her return, she was examined for many things, but never H. pylori. She started having a lot of stomach symptoms years later and tested positive for H. pylori. She did a course of antibiotics and tested negative, but the symptoms never disappeared. At her doctor's office, she had to lie to get an endoscopy. She's not the first person who told me that she had to lie or mention gastric bleeding specifically to get that test. And they did find stage 3B stomach cancer. Her story greatly mirrors my dad's story: timing, course of treatment, except two things: her age. She was 31 years old. That's a 40-year difference between her and my father. And she had a reoccurrence almost 4 years later. My friend Brandy passed away at 37 years old. In her last conversation with me, she said, Aki, we need to do better. So here I am today asking all of you guys, let's do better. Yes, treatment options are so important, but we also need to work on prevention and early detection. So I'm just going to go really quickly for the people that are streaming, but what is the importance of healthcare policy? Healthcare policy refers to decision plans and actions that are undertaken to achieve specific health goals within a society. Ideally, what we want are guidelines, risk factor guidelines for all those people at risk, so that when you go to the doctor and complain of heartburn, it's easier to get a diagnostic test as opposed to prescribing medicine to try to make it go away. So how does patient advocacy influence health policy? Patient advocacy influences health policy all the time. For example, Hope for Stomach Cancer is a founding member of the GI Cancers Alliance, and through this collaboration with other colon cancer nonprofits, we've learned from them. For instance, colon cancer health policy suggests people over 50 get a colonoscopy due to 300,000 newly diagnosed patients in the US. However, new guidelines due to patient advocacy lower the age to start colon cancer screening at 45 years old. Is this enough? My colon cancer patient advocate would say no. It's not enough because a lot of colon cancer happens to younger people. We are also patient advocate members of larger organizations such as ASCO and AACR. These two larger organizations advocate for early detection and prevention through research. For example, the AACR and Stand Up to Cancer recently presented the first Stand Up to Cancer Gastric Cancer Interception Research Dream Team, early detection and interception of diffuse and intestinal gastric cancer. When the open call for ideas were announced last year, Stand Up to Cancer received 3 times the amount of applications anticipated. It was a highly competitive award and very sought after. It showed us where there is money, there is interest. I hope that others who weren't selected continue to stay focused on this important initiative. And by the way, I'm a patient advocate on the award, and I can't wait to hear Dr. Chan discussing it tomorrow at 8:30. However, the most important thing patient advocacy groups do to impact health policy is raise awareness about this cancer. After all, this is a rare cancer, and who better to inform the public? Us. We've recently had our first 5Ks of Hope race against stomach cancer, where it was a nice balance of the general community, survivors, caregivers, friends. I heard some people ask others, what were your first signs and symptoms before being diagnosed? Patient advocate groups make patients and caregivers be better patient advocates for themselves and others. Through education and resources we provide, it's the patient and the caregiver asking for the specific diagnostic. Like me, asking my doctor for the H. pylori test in 2016. The double-edged sword in this is sometimes, in the case of Brandy and many others, they do need to lie in order to get that endoscopy. Other things that we do, in particular with Hope for Stomach Cancer, we have annual symposiums, and we also have a Hope in the Bag for newly diagnosed patients. There is a organization called the Pancreatic Cancer Action Network. They have a congressional caucus on the deadliest cancer, which includes stomach cancer, and there's about 138 congressional members in that caucus. And then also Debbie Stream does Advocacy Day on the Hill. These are times where patients and advocates go and ask to keep stomach cancer in the DoD PRCRP program. So I'm going to tie everything together now. When I shared with my friends the details of the Gastric Cancer Summit, a lot of them asked, why just high-risk Asians? Recently, my friend, a stage 4 stomach cancer patient, her name is Marissa, she asked Dr. Yelena Janjian, why are so many clinicians focusing on HER2 gastric cancer when 80% of the population is negative? Dr. Jelena drew this chart. She said, look at this pie. Yes, HER2 is only a teeny slice in this pie, but if we figured this out, then we could chip away until we have a cure for every piece of the pie. And that's exactly it. If we change healthcare policy for a certain ethnic group of patients that are high risk, it will make things so much easier for everyone else. Maybe our friends won't have to lie in order to get that diagnostic done. So how can you help? I challenge the audience or those live streaming, to those that are patients and or caregivers, join me, become a community leader, and help advocate and raise awareness. Let's start a walk in your community. To those politicians and healthcare advisors, I challenge you to start grassroots H. pylori screenings in your communities. Call me, let's do this together. To the MDs and the PhDs in the audience or live streaming, I challenge you to create a Know Your Risk Factor quiz or other tools we could utilize. It's harder than you realize, but these are the tools we patient advocates use all the time to efficiently and effectively create awareness and ultimately impact health policy. Thank you so much, guys. If you have any questions, feel free to email me. Here's my contact information. And as Dr. Wu said earlier today, act in collaboration and find a solution.